This tutorial is on the sexual side effects of antidepressant medication. So candidate, the instruction is that you've been asked to see Mr. Blake, a young gentleman who's been on antidepressant medication for his depression. He's come to see you because he wants to stop taking his antidepressant medication. The task for the candidate is to take a history of a presenting complaint and to address his views, concerns and expectations. The mental checklist, candidates, which I want you to think about and for you to possibly write down, would be the following 6 points. Number 1 would be acknowledging the sensitivity of the current history of presenting complaint and possible reasons as to why he wants to stop the medication, if we're thinking that it is due to sexual side effects. 2, you want to establish the history of the depressive illness. 3, you want to then tackle the etiological factors for the reasons as to why he wants to stop the medication. And this would bring us to the sexual side effects and possible reasons for these effects that he's having, as to whether it's due to medication or whether it could be due to other factors. Fourthly, you want to establish a link of the chronology of his depressive illness and the sexual difficulties that he's experiencing, and establishing if there is a link or not. This will bring us then to the 5th point of recapitulating all what you've discussed and then formulating a management plan collaboratively with him. And the 6th and final point would be that you would need to bear in mind that you would need to obtain consent from him to speak to his wife if this is a link station. So the communication skills here, candidate, for this specific scenario, which is commonly seen in the CASC exam, is that you would need to have the ability to empathize and be sensitive to this gentleman. The possible scenario from experience is that you would be faced with a gentleman who has recently started antidepressant medication, and now, because he feels that he's possibly experiencing some side effects in terms of sexual difficulties that he's having with his wife, he wants to stop taking the medication. So as you can imagine from the scenario I've just narrated, that he might not be willing to initially divulge some details which are personal and intimate to him about his difficulties which he's having with his wife. So the key skill and the icebreaker needed here, I think, is that you need to gently and sensitively approach this scenario and acknowledge that this is something that we commonly see in psychiatry, and that you as a psychiatrist deal with similar situations on a day-to-day basis. Using your professionalism and sensitivity, I think, will be a sure way in order to ensure that you are able to establish rapport smoothly with this patient and ensure that he will be willing to confide in with you about his sexual difficulties. So once you've established that, the suggested approach I have in mind is the following. Hello, Mr. Blake. I'm Dr. Mudlia. I'm one of the psychiatrists in the hospital. I've been asked to see you as I understand that you've been on antidepressants and that you want to stop taking these medications. I would like to talk to you a bit more about why you want to stop taking the antidepressant and see how I would be able to help you. Is it all right if I ask you some personal questions around this? Okay, so once you've established rapport with Mr. Blake, you can move on then to hear from him whether he would be able to tell you the reasons why he wants to stop the medication. From experience, I know in this scenario he's usually reluctant to, and you would then need to think of other ways in which to tackle this, which would bring us to the next point, which is establishing the depressive disorder symptoms. So you would want to find out more about the antidepressant and why it was started. So finding out more about what were the symptoms that he presented with when he first was started on the medication. And then you want to establish the duration he's been on the medication for and his level of compliance with the medication. You also then want to find out how has his depressive symptoms been since he's been on the medication. This would then bring us to him wanting to tell you about the reasons why he wants to stop the medication. And the way in which I would approach it is that if he does not come out with it initially, you could say that sometimes, from my experience, a lot of my patients want to stop medication because they're experiencing some of the side effects. And you could go through each side effect systematically or ask him specifically which side effects is troubling him, if any. And then by that time, I'm sure he would divulge to you that the reason why he wants to stop the medication is because he's experiencing some sexual side effects. So this would bring us then to the third point, which is to establish etiological factors for possible sexual difficulties. So the reason for doing this is because you want to establish whether the sexual difficulties he's having is because of the side effect of an antidepressant, which we know is possible, or is it due to another cause. So the way I would approach this is using, again, a biopsychosocial approach. So biological, you want to think about whether he's got any other illnesses that can cause sexual difficulties. For example, like hypertension, diabetes, whether he's had any back injuries, any other STIs or sexually transmitted illnesses, whether he's on any medication or taking alcohol, and whether he's had any injuries that could be related to sexual difficulties. This would bring us then to some psychological causes, which you've already addressed in getting a depressive disorder history, but you could also find out about any current stresses. Then looking at the social etiological factors, you want to find out more about his relationship with his wife and some psychosexual history. So you want to find out about the relationships he's had in the past, whether he's ever had sexual difficulties in the past, and what exactly are the current difficulties that he's experiencing. So when getting some personal and intimate details, you need to continually, as I've mentioned earlier, reassure him that this is something you commonly see on a day-to-day basis and you are experienced in managing. And this, I can assure you, will be a way in which to build some trust with him and ensure that he will be able to confide in you in his sexual difficulties. The reason this is important is because you would need to ask specific questions about the sexual difficulties. I think the station is difficult because of that, and because a lot of trainees have difficulty in actually asking what are the specific difficulties. And if you're dealing with someone who's coming to you with sexual difficulties or side effects, you need to know what are the actual difficulties he's having. For example, you want to establish what his libido is like. You want to establish whether he has difficulty in maintaining an orgasm, or whether he's had any difficulties in ejaculation or premature ejaculation, and also to find out what his current desire is to have sexual intercourse. You also want to find out if he's having any fantasies with having sexual intercourse with someone else other than his wife, and whether he's had any affairs. Another common cause for sexual difficulties is impotence, so you do need to rule this out. As you can imagine, what I've just mentioned, these are all sensitive questions to ask, and you therefore need to approach it in a sensitive manner. But I can assure you, if you've established rapport and showed sensitivity and empathy from the beginning, asking these questions would come smoothly. The reason why I've mentioned putting in asking about fantasies, because I think in this scenario he has a CPN who he's been seeing regularly, so there's a possibility that he could be fantasizing about her, and when you go to the next station you might be asked by the wife about the CPN. So it's just something to bear in mind. So once you've established the current sexual difficulties and what could be the etiological factors, this would then bring us to the fourth factor, which is linking everything that you've discussed about his depressive illness and the sexual difficulties, and trying to establish in your mind and with him what the chronology of symptoms were. So you would need to establish that actually in this scenario he has had sexual difficulties even prior to commencing the antidepressant, and that his libido and desire to have sexual intercourse was decreased. However, since having the medication, they have improved. So what this would mean is, and this is the trick in the station, is that these symptoms were actually part of it. As we know, it can come in a depressive illness where the libido decreases and the desire to have intercourse decreases. And therefore the symptoms did improve with treatment, and that possibly he is not experiencing actual side effects of the medication. The only way you would be able to establish this is if you had taken a good history of the depressive symptoms pre and post treatment, and also try to elicit systematically etiological factors for the sexual difficulties. So once you've established that, this would then bring us to the recapitulation point number 5, and then discussion of a collaborative proposed management plan. So here you could attempt to explain to him that from your assessment that it appears that initially his desire and libido had been decreased, but once he started the medication that improved. And you could explain that in depression this is something which we commonly see in depressed patients, and that once people are treated with the antidepressant for a period of 3 to 6 months, we see that these symptoms improve as the depression improves. You could then suggest to him that this is something which is common, and that therefore your proposed management plan would be the following. Firstly, you could suggest that there could be some drug-free holidays where he would not have medication over the weekends. Secondly, you could think about whether, in view of what you've explained to him, that as his depression is treated and his symptoms continue to improve, that eventually his sexual function and relationship with his wife should improve. And therefore, according to the guidelines which we follow, the NICE guidelines, the National Institute of Clinical Excellence, the proposed management is that depression should be treated adequately for a period of 3 to 6 months. Thirdly, you could consider explaining that you could change the medication, as this is something important to him and you do want to help him. You do understand what he's going through, and that if he would like to stop the medication, you would rather prefer that you could change it to another medication which has a lesser propensity to cause sexual side effects. An example of this would be mirtazapine. Fourthly, you would want to also explain that there are other forms of treatment apart from medication, and these could include psychological treatment such as sex therapy, counseling, or any other forms of talking therapies which might be beneficial. And lastly, you could mention 6, that there is also evidence to suggest that if he does want to stop the medication, that you have to inform him that he could present with discontinuation symptoms from the medication. So once you've given him all the information about a possible proposed management plan, you could then move on to summarizing and obtaining consent from him to speak to his partner if this is a link station. Candidates, throughout the station, I want you to think about empathizing and being sensitive with the gentleman, because that would be the way in which to approach this successfully. The other key thing is that you need to continually reassure him that you are on his side and that you know that this is something that is important to him. Because a lot of the times our patients might come to us giving us these personal and intimate details and think that we might not be taking it seriously. However, at the end of the day, it's about using a balanced approach and explaining it's about weighing the benefits and risk. So the benefits of treating him with an antidepressant and the risk of stopping the medication. And therefore it's important to go through each of the factors we discussed systematically in order to get him to see your viewpoint of why you think it's not a side effect of the medication and rather symptomatology of a depressive illness, which would eventually improve with treatment. So then the summary would be something like this to conclude with. So thank you, Mr. Blake, for talking to me. I know this must have been difficult to tell me some personal and intimate details. From what we've discussed, I've explained to you that this could possibly be due to the symptoms of depression as opposed to side effects of the medication. And I would like to do some blood tests to exclude any other physical causes for your sexual difficulties. I've also told you that I would like you to continue with the medication if you feel that's okay. And we could look at alternative treatments if you continue to experience some difficulties. I will arrange to see you soon. I understand also that your wife would like to speak to me. Is it all right if I talk to her about this? So then you would thank Mr. Blake and move on to the next station to speak to his wife more about the reasons why he wants to stop treatment. As you can see, candidates, this is one of those stations which is tricky, and as you can imagine, because of the information that you need to collate in the station and the sensitive and intimate questions that you do need to ask. So using a balanced approach and systematic approach is important in order to master and be successful in the station. And if you approach it in the way we've discussed, the points 1 to 6, which I will repeat again, you will be able to see that actually it is not a difficult station if you know the tricks of what actually is required in the station. So the points to recap of what to discuss in a patient when you're obtaining a history for the sexual side effects are: number 1, you want to acknowledge the sensitivity of the current difficulties if it's sexual side effects. 2, you want to establish the history of the depressive symptomatology. 3, you want to establish the current sexual difficulties and the etiological factors using a biopsychosocial approach. This will then bring you to the 4th point, which is to link in as to the chronology of the sexual difficulties as to whether it occurred prior to treatment or after treatment. 5thly, you would then recapitulate all that you've discussed and suggest a proposed management plan. And lastly, you would summarize to Mr. Blake and then ask for consent to speak to his wife. Thank you again for listening to this video.